Hello, my name is Allisa. Today I'll be reflecting on the needs and challenges of disaster workers based on the video Needs and Challenges of Disaster. This video can be found in Week 6 Module Learning Resources. This assignment is part of a Crisis Response and Trauma Care Class 6323 at Houston Christian University by Professor Shawndrika Cook. This discussion will focus on three key areas. 1. The needs and challenges of the heroic phase. 2. The honeymoon phase and its potential crash point. And 3. The disillusionment phase, including clinical conditions and effective treatments. 1. Needs and challenges of the heroic phase. The heroic phase occurs immediately after disaster. In this stage, there is a surge of energy and adrenaline among responders and survivors. People often feel a strong sense of purpose and community, which can be positive and even intoxicating, as cited in the Needs and Challenges disaster video. Key needs. The needs that need to be seen during this time is clear communication and coordination among agencies and volunteers. This can be found cited on the website of FEMA. Basic resources such as temporary shelter, food, water, medicine, clothing, shoes, medical assistance, and etc. This resources has been included in the following response by P and Eve. Another need that needs to be found is emotional and spiritual support. As many individuals are highly receptive to faith-based encouragement during this time. This can be found cited in the video of Needs and Challenges of Disaster. The challenges that we can see here are physical exhaustion. This can be due to long hours, often 10, 12 to even 14-hour days without any breaks. This has been cited from the Needs and Challenges of Disaster ND. Another challenge that we can encounter is the denial of long-term needs. As many may focus on only immediate tasks and underestimate the prolonged recovery process. According to the ACA, counselors provide pre-termination counseling and recommend other service providers when necessary. I have included the following resources in my response by the ACA Code of Ethics. So in this challenge, we can see that although crisis counseling is immediate at time, some of these survivors will need extended counseling after the crisis. And there's no telling how long this can be, weeks, months, and at times years. So once immediate counseling is concluded and no more further counseling can be conducted with that certain counseling, there could be a referral made out for longer counseling. Another challenge that we can encounter is self-care neglect, which can lead to burnout and health issues later. Interestingly, denial during this phase can act as a coping mechanism. It helps individuals push through overwhelming tasks, but if unchecked, it can lead to severe fatigue and emotional collapse later, as per APA 2013. 2. The honeymoon phase. The honeymoon phase typically follows the heroic phase and is characterized by optimism, community, solidarity. People feel hopeful as progress begins. However, the video highlights that this phase often includes a crash point. This is stated in the Needs and Challenges of Disaster video. Who experiences this crash? Disaster workers and survivors alike can experience this crash. When does it occur? This can occur weeks or months after initial disaster, when the adrenaline fades and reality sets in. This can also occur, as in the video. We can see how survivors are still dealing with the issues even after years of the disaster. The interviewee states that she had spoken to a survivor who spoke as if the disaster had just happened. Why does it happen? Exhaustion from sustained effort during the heroic phase, unmet expectations as promised aid or recovery timeline fails to materialize, and physical health issues such as stress-related ailments. The video even noted increased reports of heart attack symptoms among staff and higher mortality among vulnerable populations post-disaster. This is resources noted from the Needs and Challenges of Disaster video. So while the honeymoon phase sounds positive, it can mask deep fatigue and emotional strain, making this a critical time for intervention and support. 3. The disillusionment phase. Clinical conditions and treatment. The disillusionment phase is often most challenging emotionally. Fear, anger, and hopelessness can set in as recovery stalls and resources dwindle. Common clinical conditions are post-traumatic stress disorder, known as PTSD, depression and anxiety disorders, substance use disorders, including alcohol and drug abuse, domestic violence, and gambling, as noted in the video of Needs and Challenges of Disaster. Effective treatments that can be found to help out during this time are cognitive behavioral therapy and trauma-focused therapy for PTSD and anxiety, as cited by Horrible Fall et al. Hopeful also states that the cognitive behavioral therapy reduces exaggeration of personal responsibility and contracts cognitive schemas such as catastrophizing and belief that problems are due to internal stable trait, identifies, amplifies, and concentrates on building strengths, normalizes responses, indicates that most people recover spontaneously, highlights already exhibited strengths and benefit finding rather than promoting benefit finding prior to individual's readiness, includes self-guided self-to-dialogue to envision a realistic yet challenging and even difficult outcome. For example, like accepting one's home will take months to rebuild. Another effective treatment can be group counseling and peer support programs to reduce isolation. Medication for severe depression or anxiety can also be issued out at this moment. Community-based interventions such as psychoeducation and resilient building programs, as found in the FEMA website. The key difference between traditional mental health services and crisis counseling is the way services are provided. Mental health treatment is typically defined within the mental health community, implies assistance to individuals for diagnosable disorder. In contrast, the crisis counseling seeks to help survivors understand that they are experiencing common reactions to extraordinary occurrences. Suicide prevention initiatives like the Red Cross, Neighbor to Neighbor, and psychological first aid programs mentioned in the transcript of Needs and Challenges of Disaster. Long-term recovery is essential, As the speaker noted, rebuilding the city physically may take 20 years, but emotional recovery can take a lifetime. And this resource is found in the video of needs and challenges of disaster. This underscores the need for sustained and mental health services and community support well beyond the initial disaster response. In conclusion, disaster recovery is not a short-term process. Each phase, heroic, honeymoon, and disillusionment phases, presents unique needs and challenges. Addressing these effectively requires the combination of physical, emotional, and spiritual support, along with evidence-based clinical interventions. Ultimately, the resilience and community collaboration are key to helping individuals not only survive, but to thrive after disaster. The references that I have included in my responses come from the APA 2013 Disaster Mental Health Principle and Practice, and Eve P. Basic Needs of Victim After Natural Disasters, How to Help the Most Effectively, FEMA, Federal Emergency Management Agency, The Phase of Disaster Recovery, Hopeful, S.E., Watson, P., Bell, C.C. et al., 5 Essential Elements of Immediate and Mid-Term Mass Trauma Intervention, Empirical Evidence, and the Needs of Challenges of Disaster video found in Module 6, Learning Resources. Thank you.